In Cali, Colombia, we met a plastic surgeon who's more than just highly skilled. He's recognized in scientific journals worldwide.
I have published many articles in scientific magazines for plastic surgery.
A surgeon who truly gets you.
I say this is a message for the surgeon who understands you, because I understand your language.
We visited him to learn all about the cosmetic surgeries he performs and got a peek into his unique passion outside the clinic.
I'm gonna show you my collection a little later. Yeah, I'd love to do that. Hi, my name is Murillo. I'm plastic surgeon here in Cali, Colombia. I did my studies of medicine in Brazil, also my training in plastic surgery in Brazil. Since then, I have been working in many places. In the United States, I was professor at Louisiana State University. Also, I did some work in French Guiana and in Mexico. I have published many articles in scientific magazines for plastic surgery. Here is about belly button surgery. See, this is, and in this one, we got the best techniques for belly button. And I put my technique, which is unique in the world, because it's emulate the normal process. It means it tries to follow the same step our belly button in the natural procedure. When we are born, how does it is formed? Among all my publications in plastic surgery, I have this one here in the PRS, which is the most important journal in plastic surgery in the world. And here we publish the behavior of the fat after a fat injection in the buttock. You see, I'm showing how was the buttock before fat injection and how it is after fat injection and how it remains with over the time. You see, this was the first publication in the world showing with images this behavior of the fat injected. I've been in practice for almost 36 years, and you asked me about Louisiana State University. I was professor for about 10 years. International patients, they come here for liposculpture, so liposuction, tummy tuck, and now with new devices, we have been doing less tummy tuck because with a new machine, we can avoid tummy tuck and do a liposuction. When the skin retracts, it shrinks, and in this way, in a lot of patients, now we can avoid tummy tuck. And they come also for breast augmentation, nose job also. This is the most important procedure inside of plastic surgeon. I'm a normal human being, so I like a lot of things like everybody else. For instance, one of my hobbies when I'm here at home is playing my guitar, or this is the sport. I'm a black belt. Also, I like dancing, singing. I have my coins and bills collection. I do numismatic. For our patients, we have, first of all, a very good team with accredited anesthesiologists, good nurses, good surgeons to help us with the procedure. Everybody's accredited, is certified for the local authorities, and also the facilities are well done, well prepared with all the devices we need. People coming from abroad, I need they to send first a medical record, some pictures in the way I already have sent to the company, a model of pictures, and to have a video consultation. And why? Because it's important to know what are the patient's expectations. It's not the same thing when you tell me, I want a liposuction, but I don't know what do you think about liposuction, what do you expect about this liposuction. That's why it's very, very important to have a video consultation. After that, I'm able to do a quotation of the procedure. Before is very hard, because it's like you ask me, hey, I want a car. How much does it cost? And I tell you, what kind of car, what model, what year, in what condition. So you need to have a context to make a good pre-operation service. I have patients from many countries. It is because I have the facility to speak many languages. So I speak a little bit English, also French, Portuguese, Spanish, Italian. Not too well, but I speak a little German, and I do a survival Chinese and survival Romanian. So in this aspect, people come here and they are happy because they don't need a translator or a person to translate their wishes. So they can talk directly to me. That's why normally I say this is a message from a surgeon who understands you, because I understand your language. I have patients from Italy, Canada, from United States. I have had some from Germany too. Yeah, it is because of the facility to communicate. Before the procedure, you gotta be here at least 3 days before the procedure, and then according to each procedure, we can talk about the time to stay after. For instance, for liposuction, I say 2 to 3 weeks. When we talk about tummy tuck, 3 weeks are the most suitable. For facelift, it is the traditional one. I ask to stay 3 weeks. If it's done through lipolaser, 2 weeks are enough. For gynecomastia, 2 weeks are okay. For eyelids, 10 is a good time. All this time I'm talking is after the procedure, because for all of them, it is good to stay 3 days before.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.